So I did my PGY1 residency at DCH Regional Medical Center in Tuscaloosa, which was just a general pharmacy residency, but it actually was a lot of inpatient work. So I got to spend time on the inpatient side in the hospital with actually medical residents like we have here. We had medical residents in Tuscaloosa, and that was something that I really desired to have in my PGY2 residency in the outpatient setting, which is something that we have here.
My PGY1 was completed at Prisma Health in Columbia, South Carolina. This was a focused PGY1 in ambulatory care pharmacy, and I gained a lot of experience in both primary and specialty care. Through the things that I learned there, I was able to bring that knowledge and experience here to Christ Health Center and establish new pharmacist-led services.
Something I was really looking for in a PGY2 program is a big environment of interprofessionalism. Something really unique about Christ Health Center and our PGY2 residency in ambulatory care is that we're never working just by ourselves. We see patients alongside the physicians, alongside the medical assistants, and alongside the nurses, as well as our learners, so our students as well that we have here, medical and pharmacy students.
When I think about pharmacy, one of the words that comes to mind is collaboration. Having pharmacy in office has been very helpful to help collaborate in patient care, and I've noticed better outcomes because of it.
So even though I completed a PGY1 in ambulatory care, one of the things I was really looking forward to in a PGY2 in ambulatory care as well was a longitudinal experience. I've been able to have that experience so far at this program already. In the first couple months, we've established a couple new services, including Medicare annual wellness visits and hepatitis C focus, and then a hospital follow-up clinic with others in the works as well. Our patients here are very special at Christ Health Center. We have a variety of disease states and also needs among our patients. And one of my favorite things about our patients is the opportunity to care for their whole being, including being able to pray for our patients. We take care of not only their physical health, but also their spiritual and emotional health. More than simply seeing the life made well, we strive to see the well made whole and each patient living life abundantly. So the residents and attendings here are so excited for us to be involved with these services. It is a great collaborative environment working with them, and they're very excited to have us establishing new services and are always coming up with new things that we can be doing.
I've always really valued multidisciplinary approach to medicine, and I really think that pharmacists coming in alongside us really do add benefit to our patients as well as our own experiences in clinic here as residents. Just being able to work with the pharmacy residents here, they've been able to help us with our annual wellness visits, being able to come alongside us and say, hey, can you help me with this patient, and letting them review the medication list with me and talking about potential side effects and things that are going on. It really does help everything just run so much smoother, and I think that our patients have seen a really big benefit from having our pharmacists on board here.
Something really unique about Christ Health Center and just this whole environment is that we're really truly forming relationships with everyone here, and not just the pharmacy team members. We're forming relationships with the physicians and the residents, attendings as well, and the nurses and the medical assistants, our MAs. We are not just forming relationships based on patient care, but we're actually forming relationships based on real life. Somebody might get engaged, somebody may have a baby, and we're there for each other and we get to celebrate those little moments. So it's great to have not just a work family, but also really good new friends.